Hello and welcome to Wellness Watch. It's a new day and we're back once again with a new episode, a special show curated to ensure a healthy you and to acquaint you with a wide array of possible treatments and medical procedures India offers for various ailments. Let's embark on this medical journey, Wellness Watch, with me each week. I'm your host, Preeti. Our immune system is a complex network of cells, tissues and organs that work together to defend your body against harmful invaders such as bacteria, viruses and parasites. However, in some cases, the immune system can malfunction and attack the body's tissues, healthy tissues in fact, such as skin, joints, organs and nervous system, leading to autoimmune disorders. Now, these conditions can affect various parts of the body, causing a range of symptoms and complications. Today in Wellness Watch, we will explore autoimmune diseases and their impact on health. Autoimmunity is a growing health concern that affects millions of people, particularly women and children. When our immune system, which is supposed to protect us, starts attacking the body's own cells, serious and long-lasting diseases can arise. Today, we take an in-depth look at the causes, effects and management of autoimmune diseases and how they impact our health. Here's a report by DD India's Harshita Oberoi.
Our immune system is designed to be our body's shield, fighting off harmful invaders like viruses, bacteria, and other pathogens. It acts as a defense mechanism, safeguarding our health by identifying and destroying any foreign threat. But sometimes things go wrong. When our immune system turns on itself, attacking our own healthy cells and tissues, it can result in a range of diseases known as autoimmune disorders. Autoimmunity is complex and its consequences can be serious and long lasting, especially for women and children. The symptoms can vary, but when they occur, it's clear that something has gone awry. Normally, the immune system strengthens the body, allowing us to fight infections, heal from injuries, and remain strong. However, in cases of autoimmunity, the body's defenses no longer work properly. Instead of protecting us, the immune system starts damaging its own tissues, leading to a variety of diseases. Diseases like lupus, rheumatoid arthritis, multiple sclerosis, psoriasis, and celiac disease are just a few examples of autoimmune conditions. These diseases can affect different parts of the body, from the skin and joints to blood cells, muscles, and even vital organs. The causes of autoimmunity remain largely unknown, but genetics plays a role. People with a family history of autoimmune diseases are at a higher risk. The effects can be devastating. Women, in particular, are more likely to suffer from autoimmune diseases. During pregnancy, these conditions can lead to further complications for both the mother and the baby. For children, autoimmune diseases can cause long term health problems that require lifelong management. But how can these diseases be managed? The first step is recognizing the signs and seeking the right medical treatment. If you're experiencing persistent fatigue, frequent infections, or unexplained symptoms like joint pain or skin rashes, maybe it's time to consult with a specialist. Early diagnosis is key as autoimmune diseases can be controlled with the proper medical intervention. Treatment usually involves medications to suppress the immune system, reducing the inflammatory response and preventing further damage. But managing autoimmune diseases isn't just about taking medication, it's also about making lifestyle changes. A balanced diet, regular exercise, and stress management are all essential for maintaining immune health. Preventing autoimmunity in the first place is a challenge, but understanding the triggers can help. Factors like genetics, environmental stressors, infections, and even hormonal changes can increase the risk of developing autoimmune conditions. So, being proactive about your health and taking necessary steps to protect your immune system is crucial. For those already diagnosed with autoimmune diseases, managing the condition requires a combination of medical treatment and lifestyle changes. With the right approach, these diseases can be controlled, allowing you to live a healthier, more fulfilling life. But perhaps the most important takeaway is the need for awareness. Autoimmunity may seem like a mysterious condition, but by understanding its causes, symptoms, and treatments, we can better protect ourselves and our loved ones.
Autoimmune diseases are complex, but with early diagnosis and right treatment, managing them is possible. Stay informed and take proactive steps to protect your health. Harshita Oberoi, reporting for Wellness Watch, DD India.
All right, it is really tough when the protector itself becomes a destroyer. Autoimmune diseases are chronic conditions. This means if you have an autoimmune disease, you'll probably have to manage it and the symptoms it causes for the rest of your life. They can affect almost any tissue or organ in your body, depending on where your immune system malfunctions, including your joints, muscles, skin, blood vessels, digestive system, endocrine system, nervous system. Up in the show, we will look for answers for these important questions. What are autoimmune diseases? What are the symptoms of autoimmune diseases? How are autoimmune diseases diagnosed? What are the risk factors? And we will also discuss the medical advancements which have been made in India with regard to autoimmune diseases. All over the world, India is being recognized as a medical hub, providing cost-effective, reliable treatments to the people and patients from across the world. Up on your screens, we have important institutes and hospitals which provide medical treatment when we talk of autoimmune diseases. Up on your screens, we have the All India Institute of Medical Sciences, New Delhi, Christian Medical College, Vellore, Lady Hardinge Medical College, Delhi, and Sir Ganga Hospital, Delhi. So these are some of the hospitals and institutes that are providing reliable, cost-effective, world-class treatment when we talk of autoimmune diseases. To talk more about it and to throw more light on autoimmune diseases, we're joined in by guests today. We're joined in by Dr. Ghanshyam Pangtey, Professor, Rheumatology Division, Department of Medicine, Lady Hardinge Medical College, New Delhi. And virtually, Dr. Neeraj Jain is joining us. He is Professor, Department of Rheumatology, Sir Ganga Hospital, New Delhi. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. Dr. Pangtey, to begin with, I would want you to acquaint our viewers, telling them about what constitutes autoimmune diseases. What are autoimmune diseases?
Yeah, autoimmune diseases, like you have shown the snippets also. So it's a very vast group of disorders. It can affect your any organ. It can affect your joints. It can affect your skin, gastrointestinal tract, endocrinology, or even diabetes can be occurred. Like type 1 diabetes is an autoimmune disease. So this all occurs because your immune system is not able to identify your normal cells. So your cells, your tissues, whichever are there, the body thinks that it is foreign to the body and it's not part of you. So what happens, your immune cells, especially WBC or a white blood cells, we call it leukocytes, they attack your these own organs. And when they attack these organs, they can damage that organ and that can lead to a lot of illnesses, diseases. Most common diseases, like we have already shown to the audience, like rheumatoid arthritis, which will present like a lot of joint pain, swelling, especially hand joints are the commonly involved. While non-autoimmune disease, joint pain or a disease will be osteoarthritis, which affects your knees and weight-bearing joints. Similarly, a rash or a skin rash is very common in these disorders, which may be presentation of a systemic lupus erythematosus or a lupus disease we call. Other than that, it can affect your gut, it can lead to malabsorption, it will lead to a lot of maybe a diarrhea, or malabsorption means whatever you eat, your body doesn't accumulate those things. So there will be very vast symptoms. Similarly, it may present as an anemia also. Sometimes there is an autoimmune hemolytic anemia where your own cells are destroyed by these white cells generates a lot of antibodies. So they attack your own RBCs and red blood cell, that causes hemolysis of the red blood cell leading to anemia, and one of the common symptoms will be a fatigue. So patient will fatigue, thoda sa kaam karte hain, they feel they are very tired and all. So symptoms will be maybe non-specific. So whenever those symptoms are lingering on, going on for a longer time, and these common symptoms come, you should consult a physician, and your physician may consult a rheumatologist or expert in immunology.
All right, I'll take that forward to Dr. Jain. Dr. Jain, this is very strange in the sense that the immunity of the body is attacking the body itself. If I may put it, as the protector is destroying, the protector itself is destroying your body. How does this really happen? I mean, I would want you to explain to our viewers in very simple terms, when is it in the stage of life of a person that this occurs, and who is more prone to autoimmune diseases?
Yeah, thank you, Preeti. Thank you so much. Actually, exactly, we still don't know, and we are still not able to find exact cause of all these autoimmune disorders, why they are triggered, and what exactly starts the process. But what happens is, as Dr. Ghanshyam was saying, the snippet also shows that whatever is for our protection, it starts working against us only. So you ask in a simple term, if you have 100 army personals who are there for our protection, and out of them 10, 20 just get something wrong about them, and they attack the other 80 persons.
Yes.
So those our protection, they start attacking us. So maybe if you have a viral attack in your body, or a bacterial attack in the body, or any parasitic attack in your body, or maybe some changes in your environment, or maybe some genetic factor which predisposes you. So your body tries to attack that in its own way, and that triggers this autoimmune disease. Still, a lot of research is being done, and we are still not able to pinpoint what exactly is the triggering mechanism.
All right, Dr. Pangtey, do we have stages of autoimmune diseases? Because the symptoms which you just pointed out, these are the symptoms which we face almost every day in our day-to-day lives. So when is it that a person should be worrying about autoimmune diseases? When is it that a person should be seeing a specific doctor? And who is prone to autoimmune diseases? Do we have a specific age group of people? Are kids also equally susceptible? Talk more about it.
Yeah, it's very difficult. It's not very common as such if we say it's autoimmune disease. So symptoms are very common, you see in your mouth. So problem will be that a lot of health checkups are going on. So you have a lot of tests done, like we have ANA test, rheumatoid factor test. So those tests may be positive before the disease comes. So there will be a preclinical stage also in autoimmune diseases. But when these symptoms keep on lingering, and they are not like Dr. Neeraj already said, that these are some of the protectors, autoimmune cells are there. When we do a test, something like that, someone is going on a fever, which is one of the common symptoms of fever in autoimmune diseases. Like systemic lupus erythematosus may have a fever, there is a vasculitis disease, vessels get inflamed, a lot of inflammation is there. So when that fever doesn't improve after 7 days or 14 days, which is a common for fever, when those fever doesn't improve with antibiotics, so counts are high, you give antibiotic, doesn't improve. When those symptoms are slightly different than the normal or a typical presentation of a disease, there you should think about an autoimmune disease. And those features will be very common. A lot of these symptoms like joint pain, rash, and these fever, and the blood cells also, counts also. So those diseases may have either very low count or very high count of WBC cells. So those features and some lab tests may help you in diagnosing this autoimmune disease. But as such, you need a thorough clinician or a good physician to diagnose this disease. And just by lab tests you cannot identify. You have to examine the patient, and all the data should be correlated, clinical, lab parameters, and then how the patient is improving or not improving with treatment. So there we will get a clue.
Okay. Dr. Jain, do eating habits and lifestyle of a person, does that also make a person prone to autoimmune diseases?
Yeah, definitely. That diet and eating habits, or maybe some addictions, they play a big role in all these triggering autoimmune diseases. Especially what we have found so far, or the maximum research has found so far, smoking has been the biggest culprit. So if you see all these autoimmune diseases, especially rheumatoid arthritis, so those who smoke, their disease like runs 5 to 10 times faster, and the control is much less. And whatever medication you give, they don't work that well. So if you ask me, then the smoking, tobacco, or any other sort of unnatural addiction is definitely not advisable. So even alcohol, that should be avoided, because many of diseases like what we see gout. So in gout, we will ask them not to take any alcohol, because if you take beer or any wine, whiskey, they will have a trigger of gout. So in general, ideally all these should be avoided.
All right, what are the risk factors, Dr. Pangtey, if a person is suffering from autoimmune diseases? How long can the person live? What are the risk factors also associated?
One thing you asked, ma'am, that what is the age group of
Yes.
these diseases? So young patient and females, because of these hormonal changes, especially estrogen, has some important role to play in autoimmune disease. So these are the common people who will develop autoimmune disease. Genetics, as Dr. Neeraj has already told, genetics is important cause. There is some genetic mutation or something genetics which the person has inherited from family. So someone's family, mother, father or a parents, if they have some autoimmune diseases, the child has slightly more chances to develop autoimmune disease, or although it's not one to one. Like mother or father has an autoimmune disease or rheumatoid, the son or a daughter will develop a rheumatoid is not 100%, but chances become higher. So family history will be important. Diet and all, Dr. Neeraj has already told you that is play an important role. Other than that, exposure to a lot of toxins, like we are exposing a lot of exposed to a lot of pollution in Delhi and other areas, a lot of radiation like ultraviolet radiation, ozone. So these all radiation all may be part of some these damage to our genetics and it may we can call it environmental factors. So these
Right.
some genetic factors is there, one environmental factors comes into role, and then the person develops a autoimmune disease. So
All
this is
right,
the point.
Dr. Jain, Dr. Pangtey talked of how autoimmune diseases are diagnosed, clinical tests, lab tests. But then when we're talking the stages of autoimmune diseases, how prominent are the symptoms, one? And also added to that, when we talk of the stages, are the autoimmune diseases diagnosed in the early stages, or is it only in the extreme cases when the person gets to know that he's suffering from an autoimmune disease?
Yeah, so it's always better that if they are diagnosed as early as possible. So it depends, like in country like India, where we have so much easy access to specialists. But only problem is that are you being referred directly to the specialist or not? So the physicians or a general physician, they be tuned to diagnose, or they should have a high index of suspicion of all autoimmune diseases. For example, as Dr. Ghanshyam was saying, the fever doesn't go down, or someone is having joint pains, or maybe like someone has an eye involvement which is not suggestive of infective etiology, or maybe someone has a skin rash which is just not going with routine anti-allergic medications or some low dose steroid, or maybe someone has muscle involvement, which suppose he has a difficulty in getting up. And so there has to be some high index of suspicion to pick up all these autoimmune diseases. And maybe like nowadays we have so much of blood tests available which are known as some biomarkers, so which can predict an early diagnosis, early disease pickup. So the bottom line should be like, yeah, very well. We can easily pick up them very early, and then, so the dictum is that you hit early and hit hard. So if you pick up early, then you will treat early, and then they get better. That's the bottom line.
All right, Dr. Pangtey, if a person is suffering from an autoimmune disease, it means that it will stay with him for the rest of the life. But then how serious can it get? Is an autoimmune disease life-threatening?
Yeah, it's a very heterogeneous group of diseases. Like we have a systemic lupus erythematosus, which we have shown or discussed also. So it may present as a mild form where only skin rash is there. So they will have, whenever they go to outside, when they expose to sunlight and all, they have a lot of rash, photosensitivity. So this may be a common presentation. But as you already said, it's autoimmune diseases. Usually it lasts very long or years. Rare to rare instances, like in 100 patient, 1 or 2% may have a spontaneous resolution also. They may improve also, but most of the time it remains there. But treatment is available. Nothing like stigma that it's not treatable. And some of the sometimes this disease may be very, very fatal and very severe. So that's why we request the patient to have a regular follow-up. So we ask patient to come every 3 to 4 months to have a clinical examination, blood tests as well as lab tests. And like similarly lupus, so mild form will have only skin lesions, while severe form will have severe kidney involvement, which may lead to total destruction of the kidney, and patient can only survive with dialysis or a transplant of his kidney.
Does the severity of the disease also depends on the organ which is being attacked? Say for example, skin, or for that matter joint pain. These are mostly say area specific or weather specific symptoms which we face. But then eventually are autoimmune diseases season specific or area specific? How do we understand more?
We will take an example of lupus only.
Okay.
Like in a sun exposed, in a winter you don't have much of a sun, so there may be less flare of lupus skin lesion in winter season. So summer, when more sun exposure is there, more
Yes.
UV light is there, there will be more exposure, more. So seasonal variation is seen in autoimmune diseases. Severity, we have said that skin is not a major organ for body. So skin rash and all, you can put a lotion and local treatment. So we don't call it major disease or a severe disease. While similarly the kidney, which is very important, or CNS. So CNS lupus or a CNS SLE disease is very severe, it may be fatal. So there you need a treatment with a very aggressive immunosuppression. You will have to give a very high dose of steroids and other disease modifying drugs. So we call severity according to the importance of that organ. So that kidney is very vital, brain is very vital, skin is important but not that vital. So we call it, if skin and just muscle and joint involvement in SLE, we will say it's a mild to moderate disease. Although skin eruption may be very severe, whole of the skin may be totally eroded and you will have a lot of blood oozing and all. So it will be severe skin disease. But still, until a secondary infection is there, there is not life threatening. But lupus nephritis or a kidney disease and CNS are the major lupus disease which can be fatal and need continuous observation, every follow-up, and it's treatable. We are not saying it's not treatable, but if you don't treat, if you don't have a awareness about that SLE can involve these organs, you will have a very bad prognosis and it may be very bad for patient.
All right, Dr. Jain, is immunosuppression always done through medicines? Do we have any home remedies, or for that matter, can this be done by individuals at home, or is it only through medicines that immunity can be suppressed?
Yeah, that's the big issue actually, and it's a lot of myth about all these immunosuppressions. So that's we face daily in and out that patient will ask, Dr. Saab, ये immunosuppression देके आप हमारी immunity खत्म कर रहे हैं. It's actually vice versa. So if you start immunosuppression or what you call as immunomodulators, they actually they put your immunity on track. So your immunity improves and then your disease is controlled, so you are prevented from other infections. So that myth has to be taken out from the society. And definitely if you start immunosuppressants with a regular follow-up, they are really wonderful drugs. And so nowadays, maybe like after oncology branch, the rheumatology has been the top branch in which we have daily almost, we have a new drug coming up, which is so much, they are more safe now and they are more affordable now. So we, from immunosuppressants, from oral tablets to injectables, initially we used a lot of IV medications. Nowadays we have subcutaneous medications. Even the biologics, which is the very potent medicine, is now available orally. So our message to all people in society is that don't be scared of immunosuppressant. They are life-saving for you, and now we are able to treat these patients. Maybe we'll not speak about cure, but we will speak about near cure. That is, we call it as almost a very good control of the disease, which is as good as cure.
All right, for our viewers who are joining in, you're watching Wellness Watch, and today we're discussing autoimmune diseases. And to help us understand it better, we're joined in by guests. We're joined in by Dr. Ghanshyam Pangtey. He's Professor, Rheumatology Division, Department of Medicine, Lady Hardinge Medical College. And virtually, Dr. Neeraj Jain is joining us. He's Professor, Department of Rheumatology, Sir Ganga Hospital, Delhi. Dr. Pangtey, Dr. Neeraj just pointed to the advanced drugs that are available in India. I would want you to explain to our viewers what medical advancements have been made in India with regards to autoimmune diseases.
Yeah, last decade we will say that a lot of advancement has seen in rheumatology. As Dr. Neeraj has said, the two branches which has flourished in last decade is medical oncology and cancer treatment and rheumatology. So we have a lot of drugs which can be available as tablet as well as injectable drugs also. We call some of the drugs as biologics. So these are the made from some body cytokines. We know that science that these are the WBCs or these white blood cells. They generate a lot of cytokines, and like interleukin 6, we call it TNF alpha. So we know that these are the molecules which are attacking your cells, your own cells. So now we have chemicals or these molecules, biologics, which are acting against those specific cytokines. So we can block those cytokines like TNF alpha, IL-6, IL-1 and all, and we can control this disease. And the amount of and the response to these drugs are very, very good. So these are almost like Dr. Neeraj has said, it is like a cure only. So but problem is that drug has some half-life. After some time it goes off from the body. So it has to be given repeatedly. So some injection may be given monthly or a 2 weekly or maybe a 6 monthly. So these drugs are very, very effective and almost we can cure the patient. So only thing is we have to be in a regular follow-up with a specialist, and nothing to worry about that I have an autoimmune disease which is not curable. Almost is curable, and only thing is we have to follow with a specialist.
The symptoms can be managed.
Symptoms and treatment, and your organ damage can be prevented if they come in time, because once organ get damaged, it cannot be reversed, but we can still make a disease stable.
All right, up on your screens, you're watching Wellness Watch, and now we will have a quick rapid fire question round for some myths of our viewers to get cleared by our guests. Dr. Pangtey, pharmaceuticals are the only treatment for autoimmune diseases. Is it so?
Mainly pharmaceuticals, but a lot of new therapies has come up, like even stem cell transplant and other things are also available.
Dr. Jain, gut and digestive health have no connection to autoimmune diseases. Is it so?
They have because as in the olden days they used to say that everything is related to gut. So now we have come back to the same theory, and we think that probably the gut microbiome or the gut the bacteria or maybe flora is the triggering factor of all these diseases. So at the bottom line is that we have to have a very good care of our gut. And now all this research is very targeting towards the gut microbiome, and probably we will have more medication available with us.
All right, Dr. Pangtey, autoimmune diseases can only affect the older people. Is it so?
It can affect everyone, all human beings, although it is more common in children and especially females, and pregnancy is one of the risk factors, I will say.
Dr. Jain, autoimmune disorders are contagious, are they?
No. They are not contagious because the mechanism is absolutely different. So you need not be worried about if you are caring for caring a person with autoimmune diseases. Please take out this myth.
Dr. Pangtey, stress is the only reason for an autoimmune disorder.
No, we have already discussed genetics and environmental factors are important. Although stress management has an important role, and also stress, we have a social backup should also be there to improve, control the stress.
Dr. Jain, can diet only cure autoimmune disorders?
If you ask about the allopathic medical system, I will not agree with this statement as a whole, but yeah, definitely it is an integral part of your management. So diet, exercise and medication should be a combination therapy.
All right. So that was it when we talk of Wellness Watch today afternoon, discussing autoimmune diseases. Thank you so much, both of you, for joining us this afternoon on Wellness Watch and helping our viewers understand the autoimmune diseases. All right, so as put across to our viewers and to us by our guests, autoimmune diseases are like uninvited guests who never seem to leave. They stick around, sometimes for a lifetime, reshaping the way our bodies function. They not just play tricks on our bodies, but can also mess with our minds. Living with a chronic illness can make you feel down, isolated, angry, and downright sad. But chronic illness can also be a chance to find strength, grace, and even humor amid the challenges. Remember, Mahatma Gandhi had said, strength does not come from physical capacity, it comes from the indomitable will. And it is this strength that helps you keep going. With that thought, we'll end this edition of Wellness Watch this afternoon. Till we meet next, take good care of yourselves. Bye-bye.